for the day, Clemento Suarez.
Nobody is called.
Co-host for the day, Dr.
Thank you very much.
Clemento
Thank you.
Suarez.
Thank you. God bless.
Here on Health Content today, we shall be discussing a very, very sensitive topic, an important one. Like I've always said, every part of the body can be cancerous. When there are cells, can develop cancer. When it comes to women issues, there's always one doctor who is well versed in it and always passionate about it. Someone I call my sister and a specialist family physician.
Hey.
Dr. Akosia Mahamudu.
Hey.
Dr. Akosia Pia.
Hey.
Akosia,
Yes.
you're welcome.
Thank you.
Clemento,
Thank you very much.
please. Today,
Always
the discussion,
at your service.
is it something you see at right?
At your service.
You have to take us to the street.
That's right.
Yeah, man.
Lord, what is cervical
Okay, I'm
cancer?
confused.
It's cancer in the cervix.
But where is the cervix?
Totally.
Huh? Where is the cervix?
Yeah.
Where?
But why is it called Tatali?
Mayfield. Is that title?
Like okay. It's flat and
But have you heard of anyone
is-
with cervical cancer before?
I've heard it, but I've not encountered
Encountered one
anybody
before.
yet, so I don't really know. But yes, there's the totally.
Dr. Takusia,
Yes.
please, when we say cervical cancer, I think for the benefit of our listeners and our viewers, what is cervical?
Sometimes when you do this and I get angry, it's like what you got from him.
Some of the also do that.
And I'm
He said-
So for the
it's a
benefit,
cancer for the of the
yes. So you have to acknowledge what I've said. Don't just throw it
Well,
away.
Okay, but he's
How
right.
is-
Okay.
Yes.
He's right.
it's right out.
It's a cancer of the cervix.
Cancer.
I said totally.
I said,
And no, can I say?
I'm trying to say that it was a cancer of the cervix. I acknowledge that one. And I'm
Yes.
trying to say,
Where
where is the
and
cervix?
I'm a yes.
Oh gosh, where is he?
Like,
And then mommy,
Sister
brain
Khan.
wise on pest offering.
I didn't even wow. What they can.
Okay. So when we talk about the cervix, then we are talking about the opening to the uterus. So the layman will call it the womb. Say awodieno. So at the womb there's an exit where when a woman gets pregnant or when you have your menstruation at time of the month, it passes through a point that is called the cervix to come out of the vagina.
Yes.
So we'll just say that is the entrance or the exit of the womb. So that's
Where
what
is
it is. Oh, the womb is tata.
Totally.
The womb is totally. It's down there.
So, what is it? How does it come about? What causes this whole cervical cancer, Dr. Suarez?
Well, I think we've learned about breast cancer, so I know little about cancer and cells.
Okay.
When the cells are growing, yes, so whichever part of the body it grows, it becomes cancerous.
Okay.
So the cervix area, when
The opening to the womb.
yes,
Okay.
when you go through vagina, you go and meet it.
Okay.
Yeah. When the cells grow or outgrow itself, then it becomes cervical cancer.
Okay. So well, he's right. Oh yeah, deal. So you know,
I do
cells.
college.
Okay, I do college.
How can you
How
do
can
it?
Oh yes, science and also
Oh, okay.
medicine. Until Mama Chechim. So as he talked about cells, you know, I spoke about the uterus and then the cervix. So there's a place where the uterus will meet the cervix, and then there are cells that are two different forms. So we have what we call the ectocervix, and then the endocervix. Cervix. So in between them, there's a zone that we call the transformation zone.
Service. Okay.
So that's where the cells inside the uterus meet the cells of the cervical region, and then there's a point like a junction, and that's what we call the transformation zone. So most of the cancer starts from there,
The transformation.
the transformation zone. But I'm sure we'll talk about the risk factors. So some of,
Of
the things
course.
that make these cells undergo this what we call
This
metaplasia.
this show is like social studies.
Uh-huh.
No matter the topic, there's merits and demerits.
Modifiable, not modifiable risk factor. Even there, I was
Causes, yes.
That's good.
Yes. Social studies, the question be answer yet.
lack of social
broken home.
lack of social lack of,
Well, it applies.
lack of
It
technical
applies.
know-how.
It
It doesn't
applies.
show there. We're always going to talk about the risk
Risk
factors.
factors.
Yeah.
So, well, since you've introduced us,
Let's
so what are some of the risk factors? Let's start with the modifiable or non-modifiable. Okay, let's start with non-modifiable.
non-modified.
The ones that you cannot do
Anything
about.
about
So, well, we have being female.
being a woman.
Okay. Yes. So it's only women that have cervix. So obviously, it's only women.
Age.
So no. So before we talk about the modifiable and the non-modifiable, we want to talk about HPV infection.
Oh, yes.
Okay.
Well, okay.
Because we have that infection prior to
the-
some risk factors that will make these cancers come about. So this HPV, that's human papilloma virus. It's a sexually transmitted virus that young women or even men, because there are lots of subtypes that are present. So they can acquire through sexual contact. And when these cells affect your cervix, and then with time, some of these other risk factors that we're talking about, the age and other things, come in here, and then the cancers develop. So I think before we talk about cervical cancer, we have to know about the human papilloma virus first.
Human
Papilloma
papilloma virus
virus.
is sexually transmitted disease.
Yes, it's a.
So,
I've
so I
never
think
heard
what-
of it before.
You've never heard of it?
no.
Oh, okay. There are about 200 subtypes.
Yes.
But then, yeah,
But
there are
there's 16
about
18
40 of
are there.
them causes this kind of cancers. So we can have those who engage in oral sex can have this throat cancers and from HPV. There's also penile cancer from also a subtype of the HPV.
Those who have oral sex.
Yes.
You can get your HPV from the oral
Who
sex.
can get? Who can get?
Who can get
Charlie.
You can get your HPV from
oral sex?
Yes. So can you?
So yeah.
So I
now-
mean, when we start based on what? Okay, what is it? That's
No, so now so after that we can now classify them into the modifiable and then the non-modifiable risk factors. So you see, this HPV viruses, when you get infected with it as a healthy individual, your body is able to clear it. It's like a viral infection. If you are in good state of health, your body should be able to clear it. But at some point when let's say your body is in low on immunity, or then it can go ahead and develop into the cancers. So for women, normally an unhealthy individual a healthy individual can develop the cervical cancer after 15 to 30 years of infection. So that's why we are very keen on screening. Yeah, because if, let's say, you started your sexual activity at a very young age, which our children have started, let's say, at 15 years, 18 years, it's said that there's a likelihood that you
Say
can have
12.
a lot of multiple sexual partners. Maybe it's not intentional. Maybe you have a boyfriend today, something happens, you break up, another boyfriend and boyfriend. By the time you realize you've had a poo, and for people not being faithful to each other and all that, yes, so you can cross-infect each other. And in let's say if the person started the sexual activity at 18 years, let's add 15 years.
15 years.
That'll be like
15 plus 18 is what?
15 plus 18.
So I'll calculate it. 15 plus 18 years.
My math's nine. That should be around your 30s.
33.
Yes.
Good.
So at 30 something years, you can start having these cells becoming cancerous or pre-malignant, where you have to start screening. So that's why screening is very important, and now we are trying to make noise for every young woman too. So we can't say that because you are old, that is it. Because you can still be around 50 years, 40 years, and then that is when you are getting the cancer.
And then when you are getting this the early stages is asymptomatic.
Yeah.
But even before we go to the symptoms, we're still talking about
The risk factors.
risk factors, where we've gathered that they are modifiable and non-modifiable.
Okay.
So the modifiable is which one?
It's what you can do something about.
And then non-modifiable.
Cannot do anything about.
So some of the non-modifiable,
It's your age,
Okay.
your human being as a woman. What can I say?
being female.
Female
Or the female gender.
And then age female.
Even the fact that genetics,
Hereditary.
yes. If there's a family history of cervical cancer,
How is that possible? Because if there's a family history, then there's no HPV.
No, the HPV it adds on to it.
Okay.
You understand?
Okay.
You know, sometimes you can have it, but let's just say in a family where there's hypertension, you can have the genetics sort of makeup, but the way you also put up your lifestyle can influence the condition to come in. Because I've had people who come from diabetic families and are not diabetic because they are very particular about what they are eating. So aside having the risk factors, there are also add-ons. So that's where we add the non-modifiable factors like smoking.
That one is modifiable.
Hey, sorry. Sorry, big boss. Yes. I stand to be corrected. Yes, the modifiable factors like
I know smoking, drinking, multiple sex partners.
How is drinking going on?
Drinking alcohol, excessive drinking of alcohol.
So that doesn't directly causes
the. One just smoking about
but let me explain a point there. So it's alcohol itself doesn't cause the cells to become pre-malignant, but it is the aftermath of being drunk. You know, when you get drunk, there's a likelihood that if you don't take it, you might become promiscuous. So that's the connection with it, but not just because alcohol is in your system. That's why you got the cancer.
So we should cancel alcohol small. We should just put asterisk.
Hey, I said wait here, but I think no amount of alcohol. Last time we said it, no amount of alcohol is safe for the system. So
that's why anytime he asks alcohol, I just let it slide because truth is that we've established a medical cliche that no amount of alcohol is safe. So once no amount of alcohol is safe in medical balance, once you say that, stop alcohol.
Small cup or
no, be so small, you'll be
multiple sexual partners, early
koitaki.
What is that?
So that's having sex at an early age. You know, I use that example.
Koitaki is your first time of your first sex.
Oh, okay.
So your koitaki, you like this, your koitaki will be like 11 or.
Hey! Did you tell him or he's assuming?
He knows because we did it together. When he finished, then he called me that.
So your first sex is called what?
Early koitaki.
And then your first menses will be called what?
Early mentaki.
Hey!
Almost there, man. Come again.
Menaki. But also a doctor, you have to own
it. One of them chroma or casa my early koitaki. So early what? Menaki. Oh, that's nice.
So
early koitaki,
if you had your sex quite early.
Yes.
If you do oral sex plenty.
Cervical cancer. No. That one is rather throat cancer or oral cancer. But when you have multiple deliveries of babies.
Ooh.
Yes. So you know when you are delivering, when a woman is delivering, there's mostly trauma to the cervix, and that can also cause changes at some point. So many people who have a lot of children are at risk as well. Not that they are going to have that, but it's also a risk factor. Yes. Okay.
So basically, these are good information. So, any more questions, or we can zoom into the symptoms?
Let's go, but let me just recap. So the non-modifiable as being a female, age, and what again?
Physically.
Hereditary. You can't do much about it.
And all that. The modifiable is smoking. That one there is there. We cannot say drinking, but no amount of alcohol is safe in our medical. Yes.
Sure.
Multiple sex partners. It can also predispose you. And then a lot of childbirth. Please. You are also at risk. But you are at risk of having it. Let's go.
One koitaki now.
Favorite one, no?
Yes.
New one.
KFC.
KFC.
Early koitaki.
As early koitaki.
I just say, have sex in them.
In 10. But we are explaining why we see so if you had sex in it, because there can be somebody or having sex in it, but it's just one partner for life.
And the docs say, "Oh, having sex in them because we started in them. Maybe at the Ujayobi, no, Sakofobi, and we some of it do 18 or not."
Why now boyfriends you by 30.
10. Hey,
Hey,
that's good. That's
okay.
good.
Yeah. So I think that's good.
Yeah. So I mean, this whole cervical cancer. What are some of the signs and symptoms that comes with cervical cancer?
Discharge from the vagina.
Okay.
Yes. Elaboration because
Eh?
yes. See, when you see some ladies not able of, you think that is, but with almost share some slats now. Never Jose.
This is my confused. This is my confused. Do you have any
Has it? Because at night I can see what inside my hand say.
who patches a pee?
Na puff.
Hey, no.
NBA.
Debio. Then uncle who in 7 or the other.
Or this is life.
Life now
Yeah,
one gets our body now the understand why
Now ladies or the women of nowadays, how they think you will not understand. They want to show things. They want their breasts to be big for you to see. They want their nipples to come out for you to see. So some of them today wear vagina pad so that to be there for. You've seen it, don't laugh.
No, I mean I don't know about how far. What I know is the hips and then the buttocks.
Yeah.
I don't it's
there
Hey.
to look puffle.
Okay,
Because some girls there is inside you will see. So when they wear the puffle, then your eyes catch.
Okay, we're not on the street,
yeah.
so
But
I was on that army.
Those are the two. It swells up your private part and then discharge of fluid.
No.
So the street has said yes anyway.
They said they don't.
But for me, I think that what is important in today's discussion, especially with regards to cervical cancer, is that if you are looking for symptoms for cervical cancer, then it may be too late.
Yes.
It's
Exactly.
asymptomatic.
Yes. So it is the early stages. That is why Dr. Apia was started talking about the importance of screening, because then we can catch it when you don't even have any symptom. But if you are looking for symptom in the early stages, most likely there will be no symptom. But after some time, you may have some foul smelling discharge. But I wanted to talk about bleeding.
Yes. So post-menopausal bleeding mostly. Because we are talking about age. Maybe some women most of the time would have attained their menopause and they are not menstruating anymore. But now when they have sex, they start seeing blood. Or not even sex, they start seeing blood. Then it means that something might be wrong. Then I don't know cervical cancer coming outside. It's rather
Maybe you can even stay on the bleeding just a little.
Okay.
You've spoken about the post-menopausal bleed. Can even have intermenstrual bleed.
Bleeding as well, yeah.
As in, you expect your menses to come every month, but this time around it comes. There's a bleeding. Yes, 3 times. There you see spotting every now and then, and even postcoital bleed after sex.
Yeah, after sex.
Then you see that you bleed.
Let me correct something about the having your menses twice in a month. It can be normal.
Oh, okay.
Yes, because if you have a shorter intermenstrual cycle, let's say if you have a 21-day cycle, so you know the day start is 30. So let's say first you started your menses in a particular month. By the next
January, you have it twice.
January, you have it. Because everyone has stress to be. So it's not all persons having the menses twice in a month, but you know your cycle. You know that maybe I bleed every 21 or 28 days, but in between that you are seeing bleeding, then there could be something wrong. So you have to get it checked out. Yeah.
So more symptoms.
So it means that until you screen, you will not know.
For the
early stages.
By the time you see something, it means that
you are getting.
Yes. So that's why we say it's asymptomatic. Because at the beginning, you don't see any symptoms.
How do we say that thing?
Asymptomatic.
Symptomatic.
Yes.
So A means that not symptoms. So you will not see symptoms. Asymptomatic.
Those are the very early stages. But with the early one that has progressed a little, then you can now start seen the one that Tapia wanted to talk to us about.
Bleeding and all, because those lesions are they easily bleed. That's a it's a very terrible lesion to deal with, especially when we are taking the biopsy. The person can really bleed, and the discharge that you spoke about. If you've been with people who've had it before, you can even spot someone who has it at their entrance to your consulting room, because it has a very peculiar smell, such that you can easily pick it up when someone comes to you that they've started seeing some discharge and some bleeding and all that. Yeah. So we don't have to wait till it gets there. And cancer too, it can spread. So some of times when it's gone advanced, first of all, it goes into the bladder, because it's all down here. The bladder is there, the ureters are there, so that one will cause urinary symptoms. Can go into your rectum, your bowel, moving your bowel can be an issue. Then now it goes into your blood and then every part of your body. So people start losing weight, anemic, weak, and all that. And that would have been the most advanced time. And then at that time, you can really not do anything about it. So we are very keen on doing the screening, finding, because when it's just within the service, there's a high chance of survival.
Okay.
Because sometimes if it's just there, you can even see it, treat it there and then the woman is free.
So from all that we have discussed so far, it appears that the most important thing for cervical cancer is screening, isn't it?
Yeah.
Because whatever you're talking about, once we pick it early, it's almost curable. Early detection
saves lives.
Yes. So now we are going to screen for this HPV virus to make sure that you do not have, or you don't have any precancerous lesions. So how often do we have to screen, and when can we screen, and what time can we screen?
Okay.
My main interest is in the when. I wanted to ask her, at what age do you have to start screening?
Okay, so screening starts at after age 20.
Age 20?
Yes. So if you have started having sex too, we would advise that you start screening. And for the screening, there are various types. And so the normal one we hear of is the pap smear. I'm sure you've heard of it.
Yes, I like it.
Pap
I
smear.
like it.
Yes. So that's the readily available one.
Pap smear.
I
A
like it.
conventional
Like
pap smear.
Pap smear screening.
How do you like it?
It's nice.
Hey, why have you done?
My home so
Pap-
When I call you, obi and I say obi the year.
Pap
already.
smear.
send it to me, Yebi.
What
To
to
me,
me, Yebi?
organize this screening now.
Who organize? No, I for sample and I say,
Twice a day.
hey,
But pap smear, pap is the name of someone.
Yeah.
What's the full meaning of
Pap-
pap?
Papi Kojo.
Okay. Let's go to
Papa
the
Nikalu.
No, I
Hey,
said
some very did yeah, you.
Papi Nicolau.
Nicolau.
Papi Nicolau was a scientist.
He was a scientist. Yes.
So because the name is difficult to pronounce, we just say pap.
Pap smear.
But like
Because
Dr.
we are
Pia
sure
was saying,
that-
there are various ones you
Yes.
can do.
So, yes.
Apart from pap smear, the other ones,
Yeah. We can do what we call the liquid cytology.
liquid
Liquid-based cytology.
Okay.
So let's talk about the pap smear. Let's just say a little bit about pap smear. So pap smear is just looking for cells, abnormal cells. So we go into your service inside, because I told you about the transformational zone. So there's the inside, there's the outside. So we
junction.
take cells from the inside, the outside, hoping that would have taken the cells around the transformational zone. Then we view it under a microscope. So if there are any changes, then we can suspect. Then we have the liquid-based cytology, and that also takes the cells and also tries to detect the HPV virus. So when we are doing the pap smear, because that doesn't really detect the HPV virus, it's done every 3 years. Okay, because we've shortened the time that the screening is done, because it doesn't really tell much. But then if you do that with the liquid-based cytology, which looks at the cells as well as the HPV virus, then that can be extended to 5 years. We also have what we call the visualization with the Lugos iodine. So there's the iodine, we put in what we call a speculum to look at the cervix. Then we stain it with the iodine to see whether it will pick up the hand. It will change the color, and then we know that no. So there are some changes.
Yes,
coming in.
Very well. It's called litmus paper.
And then there's also the visual inspection with the acetic acid. So that one is acetic acid that's also put in the service to look at the cell changes and then So for now, I think in the past we're doing a lot of the visual inspection with the iodine and as well as the acetic and then the pap smear. But now, thanks to God, we have the liquid-based cytology and the HPV and even HPV DNA. Itself. And they are trying to introduce the type where someone can just walk into the pharmacy, buy the kits, and then do the test themselves instead of going. So down there is a private place.
So it's actually being done.
Yeah. So some people would not go because the Kwamaya, especially if they come and meet Dr. Suarez.
The two people that
fine
they never come again.
You two people didn't come again.
The two that did their pass me.
You're scared now. If they come and meet, fine girl comes to meet Dr. Weah. Sometimes they're very uncomfortable. So when the papa don't want maybe I found
So now you're saying that there are kits that they can buy and do it themselves.
In the pharmacy. But then when you it's advisable say be I would call a clinical setting now. Only doctor I discuss what is next near there. It's 3 years for the pap smear, then 5 years for
the
liquid-based cytology and HPV testing.
So
I confuse you.
No. I think he's proud of himself.
Yes. Thank you very much.
But your question is 2 ladies no. Okay, but you better catch on so I'm going to pharmacy no
But let's look at the importance of this screening. I mean, apart from the fact that it can help us to detect it early, what do you think some of the importance of screening?
I mean, like you said, that's mainly the reason to get the early detection, and then it will save your life. You can treat it, and then also it's also to prevent. But when you screen and there's nothing there, now you are advised.
But this is what come about. Deviate.
You'll be advised now to live right, so that. And they also count there.
But what would you advise to live right?
Say, be a meaning say, hey, me de my I feel matter say. I can get it too. Then I go and screen and I make sure I see that I'm here. But mama protecting me.
But we won't leave you there. That's what I want to.
We don't want to leave you there.
Yes, we will not advise you and let you go.
And
now come
yes.
vaccination.
So now we can vaccinate you.
I didn't know that there's cervical cancer vaccination.
Yes, so now that we can so that you'll be protected. But it's not just look, telling somebody to stay out of promiscuity is not an easy thing to do.
Why can't you?
It's not an easy thing to do for somebody who has already started and has been doing it for
it's easy to tell them.
For them.
You can tell them, but to do.
So by the grace of God, through the advancement of medicine, when we screen you and we know that you're not at risk or you don't have it, we can vaccinate you accordingly.
But it still doesn't mean you should go to your promiscuous life, because you can still pick it up. Because people who get vaccinated still needs to do
so
the
will you tell
screening.
them after vaccination that don't go and do this?
Yes, lucky you. But I'm talking about the vaccination. That's the point I wanted you to hit on for me.
That's all.
So there are types of vaccinations. Apia will tell us about the vaccinations that goes into cervical cancer.
So we have 3 different vaccines. But for Ghana, I'm sure you've heard that recently Ghana is vaccinating young children from 9 to 14 years.
For free.
For free. I heard it.
Yeah.
Okay, so it's going on in most of the hospitals.
Everybody needs to know.
But what vaccination is that?
So, we spoke about the subtypes of the human papilloma virus, and we said that some cause penile cancer.
Yeah.
Let's say if a male had the 16 and 18 and then has sex with the female, will transfer
the
it.
male will not get it.
Yes, but will transfer it to the female.
Okay.
So, and mostly it's a male and a female, like in our settings, will have sex. So when I prevent it when I prevent the boy from getting it, then I'm also protecting the female from getting it. So in the past, the first types that came out was what we call the severus, which had only the 16 and then the 18. But those
Because
were
those two
preserved
were
for
the one
they were preserved for the
for ladies.
females.
Yeah.
But now we have the Gardasil 9. The Gardasil 9, we have Gardasil 4. So those ones has a lot of other subtypes, and it prevents men from also getting I talk about the penile cancer, the oral cancer, and all
Genital
that. So
warts.
genital warts. So that's what we are trying to vaccinate. So also the vaccination is very good for children at a younger age, because so obi exposing who to sex, there's a 100% chance that person will not have the infections. Such person who vaccinating in term the body responding, then obi was starting having sex, because I told you about when you're infection it takes about 15 to 30 years. The young say obi was starting having the sex around 24 years, 25 years. And I feel now quite common vaccination. So you better target it, catch them young.
But why 9?
When young age, say no, when
and see, once you start menstruating.
Yeah.
Oh, okay.
Well, no, it's not even really about menstruation.
Which one?
For the vaccination, it's not really. It's just the age group. Well, I don't know about whether you have menstruated, but I know that at that age, dear, many you sure say, 9 years dear on koyen hufi. So that's the whole point. No. So catch them young, then they are saved forever.
Cervical cancer is actually devastating and it's killing a lot of women.
Yeah.
I know a few people who died out of cervical cancer.
I think I even know a doctor who actually also
and for me, I think it's more dangerous than breast cancer.
Exactly. Because breast cancer, the breast is outside.
Yes.
When there's changes, you at least you be worried.
And all that.
But this one, because it's inside. Unless you are having some pain, some bleeding that you are not really. Some people even see the bleeding, but they don't even really pay attention. So it has really gone far. Yeah. So it means that we have to be very proactive with the screening. The screening.
How long would it take one person per screening? Like, how long does it take to screen per person?
Well, it depends on the cooperation of the person.
But if you're cooperative, 5-10 minutes.
Yes, we just take the sample and then we are out. We are out. And I spoke about the instances where we have what we call the colposcopy. So sometimes when we do the visual inspection with acidic fluid and we see the place where the cells look a little bit discolored or something, we can immediately do what we call the colposcopy and then try and take that part out. So there's that part where you say you are doing screening, but you also end up treating. So it's like therapeutic as well as diagnostic at the same time. So that will take a longer period because you are doing two things at the same time. Yes. So okay.
The question is it curable?
If it's not too, like, it hasn't gone inside too much, you can.
So if it's detected early,
yes,
you can cure it.
Yes. That's
totally.
Colposcopy.
But if it's not detected early, then
and
it becomes quite problematic. Yes. If it spreads, then we are in trouble.
Okay, so I think when you find the lesions, first of all, what you have to do is to stage where the disease has reached. So we have what we call the staging, where we look at, it's a bit technical. So whether the cells are just within the cervix or they've just gone below the vaginal wall a bit, or it's gone far off in the vagina, or it has spread all over. So most of the time, we just want it inside the cervix. Okay. So sometimes when it's just inside the cervix, we have some numbers that we also use, A, B, C, depending on how we stage it. So we can decide that, okay, we'll take a little bit of the cervix, or we'll take the whole womb, including the cervix out. That's what we call the hysterectomy. So that would mean that you have a surgical...
Hysterectomy.
Total hysterectomy.
Hysterectomy is the act or process of removing the womb and the cervix.
Total hysterectomy. We can have a partial hysterectomy where we take some part. There's a total hysterectomy. Yes. Then we can also have, when it has spread, well, you cannot really do. Maybe what we can do is some debulking. So debulking means that, as you said, the whole Then you follow along with some chemotherapy.
Chemo.
Radiotherapy, yes, chemotherapy, radiotherapy, and sometimes palliative care. So the palliative care is mostly, well, all the stages need palliative care, but there are palliative care periods where you are just comforting the so-called patients to have a better life before God calls them home. But palliative care, we do palliative care in every form of disease. Because, when someone just hears the diagnosis of cancer, no matter how small or big it is, their mind starts turning. So what palliative care seeks to do is that we try to counsel you, the family, and then try to accept certain things, and then we help you through, because emotionally, psychologically, all those things will be affected. So we do what we call the holistic care as family physicians. We don't just look at the disease and say, oh, malaria, malaria. I was here tackle say if I'm mosquito only free buy. Say I was here to mosquito spray grandma.
Well,
I think it's been an insightful conversation so far. We've had fun trying to learn more about this cervical cancer. So we'll have our last words, but you've always wanted to quiz.
But let me quiz you.
Okay.
More one.
The two of us.
Two questions.
Okay.
I heard that to prevent cervical cancer, you have a lot of sex with one partner, not multiple partners. If you have one, keep going. 3 times a week is okay for you.
It's not true.
Is that what your people say?
It's not true.
So second question.
Then
is your one partner your okay?
Yes.
That is your only partner, but is that his also? Are you also his only partner?
Him there. Let's leave him.
We should leave him. No, it's also very important too, because
the question is even funny because it's to prevent.
Yes. Because the hallway is busy all the time, so nothing grows there. Have you seen pawpaw grow in the streets before? So because every day there's car coming, nothing will grow at that junction.
But if it's often, and as I'm saying, your partner has other partners that you are not aware of.
It's not only you. He doesn't have any other partner.
Okay, we assume it's only you. Okay, you.
Then the second one is using soap to wash your under. Soap can cause cervical cancer.
You know that I know.
Then
what is actually there is that we have what we call the vaginal flora.
Do you know how to wash vagina?
Hey, does he have vagina?
It's a question. Do you know how to wash?
Okay.
No, I don't.
And we are talking man to woman. We are talking. Yes.
So you see, flora. Yes, the vaginal flora. What they seek to do is that it's like vaginal health. It depends on them. So they prevent some bacteria that would have caused disease and control them from you having any form of infection. So when you use these hard soaps and then you clean the area, you tend to destroy them, and then you give them those harmful pathogens to go ahead and give you infection.
You see.
So normally the vagina cleanses itself.
So you don't need to use soap.
No, you don't. What are you cleaning?
They want the place to smell good.
Smell good.
They use sweetie. Do you know sweetie soap?
No, I don't know sweetie.
Oh, I'm a too sweetie.
And the way I did sweetie.
So secondary school, we touch our number. Who use? I shall drink nasa.
No, they would go cheap.
They be airham. Say every man number more airham. So the girls used to wash.
When the chair me, I send you.
Now you go and use it.
It's a sweetie soap. So Indian I be should be.
My doctor. Now I'm ready. Let's go.
Are you going to quiz him?
Yes.
Yeah, I'm ready.
So you've learned some new terms today. So what are they and then?
You won't remember all of them. So let's ask him what it is. Then you answer.
Okay, good.
Okay.
I thought you'd be okay. If it was okay, what is cervical cancer?
Cervical cancer is cancer in the cervix. It's the cells multiplying cancerously.
Okay.
What organism causes cervical cancer?
What organism?
What organism can cause cervical cancer?
What is the organism?
What virus?
HPV. It's called human. We are 3, and there are 3 letters. If I say one, if you say one,
no, but you are the one going up quiz. Human
papilloma.
Papilloma virus.
Good. But which
Subtype.
subtype, the two types that are
16 and 18.
Ish, I'm being
is it 100?
More.
Which people are advised to screen?
Once you have started having sex, you are active sex woman.
But can cervical cancer be prevented?
Cervical.
What are some of the ways by which
It can be prevented because there are modifiable causes and non-modifiable. If you fall within the non-modifiable, we can't do anything. But if it comes, we can treat it. But if early detection is made, we can help save your life.
And what are at what point can we have early detection?
At what point?
Like, what are some of the things we can do to have?
When you screen very often.
How often? How?
Screening, first one, if they do pap smear, 3 years. But if they do liquid-based cytology, oh my God, that one 5 years.
Man, doctor.
Ask more.
Man, doctor. So what are symptoms? What are some of the symptoms?
Symptoms: bleeding, pains inside, even sometimes during sex. Yes, and your menses can come before the normal time.
So intermenstrual bleed.
Yes,
But you didn't say
intermenstrual.
the very important word though. The signs and symptoms.
Asymptomatic.
So mostly it's A.
Yes. So when you have the cervical cancer, you may not see symptoms until it has gone far and probably spreading. So early detection means that screen early so that we can detect it and save your life. Yes. And the movie is my boy.
Oh, the boy.
Say why are they?
Why are they far? And the streets for no motion and the power.
Yeah.
I'm proud of myself. Say.
Say na say omo
Match
me
it
aba
up.
omo jimata.
Nti wokɔ na wakɔ mmɛhyɛ-
Polish bi omo pam me. Na say omo mama omo che.
Oh, I think
I'm saying me the more about
you're political.
Mo say me.
Oh, yeah, because you'll find a way so that we can get the information.
Who say matter come assistant. First time share for good. The lady be very Sally. Sally. Pam
Michelle.
because of
Pam mommy.
say me contribution here more. Opa our friend. He say when Sally France.
Said no mom.
Okay, I see my contribution here better.
So
yes, there's been another wonderful session. I mean, cervical cancer. I've heard of it. I've read about it, but I've never really had this kind of session with any professional, specialist like Dr. Akosia, and it's been amazing. If you watch from the beginning, you might have learnt a lot. If you didn't catch up us from the beginning, you can still get on a repeat, or so you can also learn
on our YouTube channel.
Please, you can go on Health Quarters Ghana YouTube and find all these things. We've talked about screening, that's early detection and all that, so that we can save your life. If we screen, sometimes too, if they screen and they find something small, they can scope. So I mean, wherever you hear about screening, go there. If it's cervical cancer month, they are also doing vaccination for young boys and all. Please, let's take our health seriously. Doctor, thank you so much for coming. You've been a blessing to us one more time. Doc.
Oh, I think we've said it all. It's a dangerous condition, but when it's seen early, it can be tackled well. So let's all make it a point to screen. And even as men, we should also encourage our women to screen. So as much as possible, let's tell them to have a part of their routine checkups. If they've
Give
not
us
made them.
money, we'll go and screen.
We'll give you.
Yes.
Great. Another educative conversation done. Keep your dial here one more time. Next week, we'll have Health Quarters your way.